Hi everyone, Dr. Hanisha here, and for today's Medical Monday, I'm going to be talking about commonly prescribed medications that increase your risk of Alzheimer's dementia. But before I get into that, I wanted to talk about my podcast, Mahan Health, that's MAHAN Health, and I wanted to talk about how my recent episode was all on mindfulness. I think this is an extremely important topic because we cannot achieve optimal health without having any sort of mindfulness practices. So it's important to listen to this episode and start incorporating mindfulness practices in your daily life. So make sure that you go check that episode out, and then make sure that you subscribe so you get the most recent episodes that I do release, and you know exactly whenever it does get released. So the next week's episode is all on ozone therapy. I'm really excited about this one. This is with Dr. Garek, and we talk all ozone therapy. If you haven't heard of this therapy or don't know anything about it, I highly encourage you to listen to this episode because we get into a lot of detail and all of the thousands of benefits of ozone therapy. So make sure that you subscribe today so that you can get the episode next week. All right. Another thing that's going on is I am having a holistic fat loss program that I'm launching in January. I'm really, really excited about this. It's a 12-week program where we will all meet virtually every 2 weeks. I will be posting recipes weekly, and we will have a Facebook group where we will everyone who's in the program will be incorporated in the group, where we'll have this sort of Facebook community or a virtual community where we can share our experiences, celebrate our wins, and then support one another. Community is so important when it comes to health, and I actually have a blog post that is out on that, and I have an Instagram post coming up about that as well. So make sure you check those out. But community is so important. This is why I've incorporated it into my fat loss program as well. And in terms of the 12 weeks, the reason why it's 12 weeks long is because research has shown that that's how long it takes to have sustained change. So this program is meant to help you get the fat off and then keep it off. That's why it's 12 weeks long, and this is why we have the community support as well. There's also going to be, because I'm so passionate about individualizing diets and how each person is so different, so it becomes a little difficult in a program setting. So I will be having you all fill out a form or questionnaire where I will determine what diet and exercise routine would be ideal for you. And so it's still more individualized. This is why it's holistic in its nature, and we go beyond diet and exercise. There's so much more to health and fat loss than just diet and exercise. So we're going to go further into that. And this program it costs about $980 for 12 weeks, but that includes $500 worth of supplements. So that's $500 worth of supplements those supplements include a protein powder from Propello Life, which I'm really excited about their brand. And then it also includes a supplement that helps her curb cravings. So this is obviously so important when talking about weight loss or fat loss, because a lot of these cravings are what make it so difficult to lose that fat. It also includes a supplement that helps to support your detox pathways. Also, some more essentials as well. So $500 worth of supplements included in the program, but I'm super excited about this because I'm actually, just for this Black Friday sale, I'm doing $100 off. So it's only $880 for a 12-week program. And this Black Friday sale is going to last an entire week. So it starts today, and then it goes until Tuesday at 11:59 p.m. Eastern on December 3rd. So I want it to be a whole week long because I think every day should be like Friday. So every day is Black Friday for the whole next upcoming week. But then after that, this deal is definitely not coming back. So make sure that you sign up today because it's not coming back. All right. And if you have any other questions about the program, please make sure to reach out and I will help answer any of those questions. I'm super excited about it. And I'm super excited about the community that's about to form in this program as well. Okay, so let's get into the topic. Commonly prescribed medications that increase your risk of Alzheimer's dementia. So the reason why I wanted to talk about this today is because I actually have recently had quite a few patients that have been on allergy medications for an extended period of time. And for example, I have this one patient who he has been dealing with migraines, and that's actually why he came to see me. He's kind of gone through all the different things. He's done even the normal naturopathic things that I would do, but he also had an MRI done because his migraines have been so constant for the last few years. And the MRI revealed that he had a mild enlargement of the ventricles and sulci. This is an indication of Alzheimer's dementia. When I saw this result, I thought, I wonder if he also has allergies, and I wonder if he's also been taking any allergy medications. After digging a little deeper, found out that he does deal with allergies and has been suffering with allergies and has been taking Zyrtec for the last 20 years. So whenever I learned this, I thought the MRI results made just so much sense, because allergy medications like Zyrtec have been shown in long-term uses. It's been shown to increase your risk of Alzheimer's dementia. So this made complete sense to me. Another example is I had this patient who was telling me he was dealing with some memory issues, and I, of course, being the naturopathic doctor that I am, I decided to dig deeper, found out that he's also been dealing with insomnia for about 40 years, and he's been taking Ambien for the last 15 or so years. And again, this made sense to me because Ambien has been shown to increase your risk of Alzheimer's dementia. So, other than that, other medications that can increase your risk of Alzheimer's dementia, other than allergy medications and sleep medications, include, there's digestive or gastrointestinal antispasmodics. These are usually prescribed for IBS-like symptoms, so if people are dealing with pain with IBS. Also, antidepressants are very commonly prescribed and can increase your risk of Alzheimer's dementia, muscle relaxants, and even asthma medications. This is why I'm so passionate about getting to the underlying cause instead of just masking your symptom with a medication. This is so important because I want to figure out, why do you have these allergies? What can we do to prevent them so that you don't need to take this allergy medication? If you're dealing with insomnia, why are you dealing with insomnia? Instead of just popping an Ambien, let's talk about what's going on with your circadian rhythm that's inhibiting you from having proper, adequate sleep, right? So if you're dealing with any of these things, please reach out to me so that we can get to the underlying cause of why you're dealing with these conditions, and so you no longer have to suffer, and you are not increasing your risk of serious conditions like Alzheimer's dementia. Okay, that's all I have for you all today. I hope that was informative and helpful. I'm wishing you all Mahan or great health, and I will see you next time.